Hello everyone, our today's discussion will be on hypertension or high blood pressure and how to prevent it. So normally every individual will like to have a healthy blood pressure or a normal blood pressure, but what exactly it is? So basically with every heartbeat the blood is pumped by the heart into the blood vessels and the pressure exerted by the blood against these blood vessels is known as blood pressure. Now, it varies throughout the day in all individuals, but if it is left untreated for a very long time and it is raised for a very long time, it predisposes you to various diseases like heart diseases, chronic kidney diseases, stroke, and blindness, etc. It takes a very long time for the hypertension to develop, and maintaining a unhealthy lifestyle like lack of physical activity, obesity, smoking, alcohol intake, stress, they all predispose to, they are all risk factors of hypertension and predispose to various serious conditions like heart diseases, chronic kidney diseases, stroke, etc. The various risk factors for hypertension are, other than these are, one is age. As we age, our blood vessels, they stiffen and there is fat accumulation. So what happens is the pressure in these blood vessels will rise. Second is family history. If you have siblings, parents or your first family having hypertension, you are already predisposed to having hypertension. Then it's high salt intake, reduced intake of foods which are rich in potassium, high saturated fat intake makes the person obese, and obesity itself is a risk factor for hypertension. Increased fat will make the body unhealthy, the heart has to work harder to pump the blood, and obviously it will cause hypertension. Last but not the least, stress. Excessive stress causes sympathetic stimulation and definitely it raises your blood pressure. Moving on, hypertension does not have many signs and symptoms many a times, and hence it is called the silent killer. And sometimes it may have signs and symptoms like morning headaches, visual blurring, fatigue, and nausea or vomiting. If you have any individual has any of these signs and symptoms, they must check their blood pressure. And checking blood pressure frequently is a very simple preventive measure to avoid hypertension. And it can be easily measured by a very simple instrument called sphygmomanometer. And it is generally measured in 2 readings. And normal blood pressure is around 120 by 80 millimeters of mercury. It is generally recorded in 2 readings, a systolic, the upper reading, and the diastolic, a lower reading. Now I will explain you what these 2 readings actually mean. Now the systolic reading, the upper reading of blood pressure is the reading which is taken when the heart contracts. And the lower reading, the diastolic reading, is the reading which is taken when the heart relaxes in between the 2 beats. And any blood pressure above 140 by 90 millimeters of mercury in 3 office readings, then the person can be labeled as hypertensive. And if the blood pressure is persistently high above this reading, it can predispose you to various heart conditions, heart attacks, heart failures, strokes, chronic kidney diseases, blindness. All of these are serious heart diseases secondary to hypertension. The risk can be prevented by taking steps towards a healthier lifestyle, maintaining regular exercise, a healthy diet, quit smoking, self-monitoring of blood pressure, and reducing stress levels, and most important is adherence to the medicine as prescribed by your physician. So we will understand all these steps one by one. These strategies, the first strategy is maintaining a regular exercise or physical activity in your day-to-day life. Having a good exercise levels is a drug-free approach to maintaining the good blood pressure or avoiding hypertension. So if the body is healthy and the heart is strong, the heart has to work less to pump the blood in the blood vessels, and definitely it reduces the blood pressure. Aerobic exercises should be done at least 30 minutes a day for most days of the week, and it can reduce the blood pressure by around 10 to 11 millimeters of mercury. The various exercises which are swimming, brisk walking or jogging, all these exercises are very important. Second is a healthy diet. You must have heard about the DASH diet. The full form of DASH is diet approach to stop hypertension. It includes a very diet rich in high fiber, fruits and vegetables, and low in saturated fats. So if you maintain this diet, low salt intake, definitely you will control your numbers, the blood pressure will remain in the normal range. Reduce salt intake also reduces the risk of blood pressure. Like each teaspoon at least will have 2300 milligrams of salt. That is quite a lot. So if you add in more herbs in your diet and reduce salt intake, read the food labels when you are buying food, and reduce saturated fat, canned food, all these contains high salt. So these things will reduce the blood pressure effectively. Next is by quitting smoking and avoiding alcohol intake. It may not be possible for a patient to go to the doctor every time. So if he monitors his blood pressure at home at various times of the day, he can give a complete picture to his doctor about the variability of his blood pressure, which may not be possible in one office visit. So by self-monitoring of blood pressure, by maintaining a healthy range, a normal range, one can prevent so many morbidities and mortality associated with high blood pressure. As I mentioned earlier, heart diseases, stroke, and chronic kidney diseases. Also, the most important point next is adherence to the medicine as prescribed by your physician. One must take the medication in time, one must take the adequate doses, which controls the blood pressure. Your numbers are very important. The right dose and the right blood pressure is very important in maintaining your preventing hypertension. So all these things are very important in preventing hypertension. Also important is stress management. Stress is a part of our lives these days. Everybody says, I have a lot of stress, I am very busy. And so all these things, if you don't manage your stress properly, it will lead to sympathetic stimulation and definitely will raise the blood pressure. So the various activities by which you can manage your stress is, focus on calm meditative activities, music therapy, and nature walk. I tell all my patients that if you focus on peaceful activities, definitely your stress will be managed well and definitely controlling the hypertension. At last, I would like to suggest that there is nothing more precious than having a healthy body, a fit mind, and a healthy lifestyle can go a long way in preventing hypertension and its various comorbidities and various complications like chronic kidney diseases, stroke, or heart diseases. So if you just maintain a healthy lifestyle, these preventive risk factors, if they are stressed upon in your life, then they'll go a long way in giving you a fit body. Thank you very much.